two other indications for the use of loop diuretics: kidney or liver failure, and they're also useful for managing hypertension. First, as far as contraindications go, it's intuitive to not use loop diuretics. Like heart, so in hypometabolic by either too much bicarbonate or too little hydrogen ions in the blood. This happens because an increased concentration of sodium ions in the collecting duct make the collecting duct secrete more potassium and hydrogen ions from the blood and into the urine. The loss of sodium also causes increased excretion of magnesium and calcium, which can lead to hypomagnesemia and hypocalcemia. However, calcium can be reabsorbed later in the distal convoluted tubule, and thus hypocalcemia is not very likely to occur. Now, loop diuretics might occasionally cause ototoxicity and hearing loss, usually with high doses. Also, ototoxicity is more common with ascites. Okay. Filtration rate. Along with inhibiting these sodium-potassium 2-chloride co-transporters, loop diuretics also stimulate the release of prostaglandins, which dilate the afferent arteriole. As a result, they increase the renal plasma flow, and they also increase the glomerular filtration rate, or GFR. However, many individuals who take loop diuretics also take non-steroidal anti-inflammatory drugs, or NSAIDs, which inhibit prostaglandin synthesis, and thus they can decrease the loop diuretics effect.
Diuretics are medications that act on the kidneys to increase production of urine and, therefore, elimination of water from the body. There are 5 main types of diuretics, at least, which filters the blood. The filtered content goes through the renal tubule, where huge runs in our funding travels through the bloodstream and acts like you'd expect an osmotically active molecule to act. It sucks water out of the cells it encounters along the way, and all that extra water reaches the kidneys as increased renal blood flow. Once at the kidneys, it gets secreted by the glomerulus into the renal tubule. Some of the segments of the renal tubule, like the proximal convoluted tubule and the thin descending limb, are freely permeable to water. So any osmotic agent that ends up here will tend to make water stay inside the tubule rather than be reabsorbed. Now this increased volume leads to increased flow rate through the nephron, so there's less time for the sodium to be reabsorbed. This causes a small increase in sodium loss, but much more water is lost. So mannitol is considered an aquaretic diuretic, meaning it promotes water excretion without increasing the loss of electrolytes. This can come in handy when we need to remove water from the body, but only in certain conditions. Is lost. So mannitol is considered an aquaretic diuretic, meaning it promotes water excretion without increasing the loss of electrolytes. This can come in handy when we need to remove water from the body, but only in certain conditions. Unlike other diuretics, which are often used to treat hypertension and edematous states, osmotic diuretics are mainly used to lower intraocular pressure in glaucoma and before ophthalmologic procedures, or to lower intracranial pressure, such as following head trauma. Since mannitol also increases renal blood flow, it can be used to flush away harmful substances that build up in the kidney. Examples include myoglobin from rhabdomyolysis, which is the breakdown of muscles, and hemoglobin from hemolysis, which is the breakdown of red blood cells. Now, for side effects, first off, right after mannitol enters the bloodstream, and before it gets excreted, it pulls intracellular fluid into the extracellular space, so it could worsen edematous states like pulmonary edema. When more water gets pulled into the blood vessels, the concentration of sodium will go down, causing hyponatremia. This is especially likely to happen in individuals with renal impairment, where the kidneys can excrete the mannitol. In a congestive heart failure, where the heart can't handle the increased plasma volume, electrolytes, there's a high risk for weakening class, flushing, and thin.
Diuretics are medications that act on the kidneys to Tonic anhydrase inhibitors, osmotic diuretics, thiazide and thiazide-like diuretics, There are principal cells and alpha intercalated cells dispersed amongst the tubule cells. The principal cell has two pumps on the apical surface, an ATP-dependent potassium pump that pushes potassium into the tubule, and an epithelial sodium channel pump, called an ENaC for short, that pulls sodium into the cell. There's also a sodium-potassium ATPase pump on the basolateral surface that again moves 2 potassium ions into the cell for every 3 sodium ions out. Now, the alpha intercalated cells mainly get rid of hydrogen ions from the blood, and they use Pull's surface, an ATP-dependent potassium pump that pushes potassium into the tubule, and an epithelial sodium channel pump, called an ENaC for short, that pulls sodium into the cell. There's also a sodium-potassium ATPase pump on the basolateral surface that again moves 2 potassium ions into the cell for every 3 sodium ions out. Now, the alpha intercalated cells mainly get rid of hydrogen ions from the blood, and they use 2 pumps on their apical surface for this. First, they have a hydrogen ATPase, which uses ATP to pump hydrogen into the tubule. Second, they have a hydrogen-potassium ATPase, which uses ATP to push 1 hydrogen into the tubule in exchange for 1 potassium. Sodium and potassium levels in alpha intercalated cells are also controlled by sodium-potassium ATPase pumps on the basolateral surface, which move 2 potassium ions into the cell and 3 sodium ions out of the cell. The reabsorption and secretion of these molecules in the principal cells, aldosterone diffuses across the basolateral membrane and binds to a mineralocorticoid receptor in the cytoplasm. Then, the aldosterone receptor complex gets inside the nucleus of the cell, where it triggers the increased synthesis of ENaCs, ATP-dependent potassium pumps, and the sodium-potassium ATPase transporters. Together, they work to increase sodium reabsorption into the blood and potassium secretion into the urine. In the alpha intercalated cells, aldosterone increases the synthesis of hydrogen-potassium ATPase to increase hydrogen secretion. Okay, so potassium-sparing diuretics come in 2 flavors according to their mechanism of action. First, we've got those that directly inhibit the aldosterone receptor, like spironolactone and eplerenone. Then we have medications that indirectly inhibit the effects of aldosterone by blocking the ENaC channels on the cell membrane, like amiloride or triamterene. This decreases the level of sodium inside the principal cells, which decreases the action of the sodium-potassium ATPase on the basolateral membrane. However, at the end of the day, both categories have the same effect. First, they increase the excretion of sodium, and since water flows where the sodium goes, they also increase water loss through the urine. Next, they decrease the excretion of hydrogen and potassium, hence the name potassium-sparing. Alright, so the major indication for cardiac output of halting in lower blood pressure. This also treats edematous states like pulmonary edema or ascites, where fluid builds up in the extracellular space. Now, the alpha intercalated cells mainly get rid of which move 2 potassium ions into the cell and 3 sodium ions out of the cell. Together, they work to increase sodium reabsorption into the blood and potassium secretion into the urine. In the alpha intercalated cells, aldosterone increases the synthesis of hydrogen-potassium ATPase to increase hydrogen secretion. Okay, so potassium-sparing diuretics come in two flavors according to their mechanism of action. First, we've got those that directly inhibit the aldosterone receptor, like spironolactone and eplerenone. Then we have medications that indirectly inhibit the effects of aldosterone by blocking the ENaC channels on the cell membrane, like amiloride or triamterene. This decreases the level of sodium inside the principal cells, which decreases the action which they increase in potassium, hence the name. Patients increase sodium and water loss through the urine, which leads to decreased plasma volume and cardiac output space. Potassium-sparing diuretics are used. The addition of a potassium diuretic increases the reabsorption of potassium in the final stretches of the renal tubule, and therefore useful in hyperaldosteronism. Hyperaldosteronism can be primary, meaning too much aldosterone is secreted by the adrenal cortex itself, like with Conn syndrome, or when a tumor secretes too much ACTH, which then tells the adrenal cortex to make too much aldosterone. Hyperaldosteronism can also be secondary when high levels of aldosterone result from the activation of the renin-angiotensin-aldosterone system. This is typically due to low plasma volume because too much fluid escapes to the extracellular space, leading to edema. Aldosterone receptor, and finally, spironolactone can also bind to androgen receptors and prevent testosterone from binding. This makes it useful for blunting the effects of testosterone in the body, like in polycystic ovarian syndrome, where there are many cysts on the ovaries that secrete excess testosterone. This can result in symptoms like infertility, hair loss, acne, and hirsutism, or unwanted facial hair growth in women. ENaC channel blockers like amiloride are useful in a condition called Liddle's syndrome, a rare genetic disease where the ENaC channels potassium. There's a risk for close monitoring with potassium supplements or other medications that could increase potassium, like ACE inhibitors or ARBs, since they also increase hydrogen retention. A buildup of hydrogen ions in the blood might lower blood pH and cause metabolic acidosis. Finally, triamterene in particular may form kidney stones and may induce acute renal failure when associated with the NSAID indomethacin. Now, we want to make a simple and secretion into the urine. In the alpha intercalated cells, aldosterone increases the synthesis of hydrogen potassium ATPase to increase hydrogen secretion. Okay, so potassium-sparing diuretics come in two flavors: a synthesis of hydrogen potassium ATPase to increase hydrogen secretion. In the principal cells, increases this according to we have medications that indirectly inhibit the effects. There's also a sodium potassium ATP